Bones make skeleton of our body, provides us support and make ourselves movable correctly. It also provides protection to our body organs and organ systems. In order to make and maintain the bones, each of us has given 4 types of cells that play significant role to keep us healthy and in shape. Number 1, osteoblast. They help to make brand new bone tissues. Number 2, osteoclast. They help to remove any unwanted or excessive bone tissues to keep the bone in shape and not overgrow. Number 3, chondroblast and fibroblast. These cells help producing cartilage and collagen proteins. Number 4, osteocytes. Osteocytes are the one who keep providing the signals to all other 3 cells that how much do they need to work in order to keep the bones maintained and in shape. Remember, when the bone breaks due to any injury or fall, it is extremely painful. But the good thing is that nature has given us the capability to get the bones healed by themselves, which is known as the process of bone healing. Now, the process of bone healing contains 5 stages to complete the healing process. Stage 1, hematoma formation. There is a small blood supply in bones through small vessels. As the bone breaks, blood vessels break as well, and they start bleeding, and the gap between the 2 broken ends start filling with the blood, called hematoma in medical term. Stage 2, inflammation. In this process, white blood cells called macrophages, which are known as the large phagocytic cells, run to the fracture site and start ingesting dead cells and bacteria. This process called phagocytosis. The reason is that nature wants to keep us healthy and safe from any infection. During this process, we get swelling, pain, heat, and this whole process and stage collectively called inflammation. Stage 3, soft callus formation. Bone forming cells reach to the fracture site and start repairing the bone where it was broken. First of all, new blood vessels start forming, and besides that, chondroblast and fibroblast start making cartilage and collagen protein on fracture sites, and a soft mass can be seen on the fracture site. It's called soft callus. If 2 ends on broken bones do not stay stable and get stressed, then it can take way longer to complete the healing process than it should, or it may not even heal, or it cause malunion. Sometimes we put a hard dressing or even cast or splint to avoid any movement on fracture site so the healing process can speed up. Stage 4, hard callus formation. In this process, in approximately 3 weeks of soft callus formation, this process starts converting into hard callus. Osteoblast play significant role to convert the soft callus into hard callus. These cells convert calcium and phosphate into soft callus, and with the time it keeps getting hard and dense. Number 5 and final stage is remodeling. This stage usually starts from 8 to 12 weeks of fracture. In this stage, osteoclasts who are just playing around, they get the signal from the osteocyte saying, hey, time to shine, baby. And they start breaking the excessive mass on fracture site in an intelligent way. This process is just to bring the bone in its original shape. Keep in mind, remodeling can take up to years, sometimes depending on a lot of factors. For example, which bone is broken? Is there any bone disease? What you eat and how you eat? Are you a smoker? Etc. And lastly, a proper bandages, cast, or splint play a very important role as well, which is usually surgeon's preference and responsibility. So always ask your surgeons what kind of dressings do you want.